in this case, ear, nose, and throat surgery in Atlanta. So Elaina, maybe you could help us understand what first began to drive you into thinking about free market approaches.
Well, first of all, thank you so much for having me. It's really a pleasure to be here. And I want to thank all of you because you are keeping my practice and other practices like mine open. We're one of the 30% of doctors still in solo independent practice, and it's been a challenge for the past 20 years or so. I've been open for about 18. And I got started in the happiest place on earth, which was Disney World. And I had to decide whether I wanted to keep my practice open or close it. And it was a coming to Jesus moment, essentially. And I decided nobody is going to run me out of my practice. It's blood, sweat, and tears. It's staying up all night. It's wearing every single hat and loving what I did and not having anybody tell me that I couldn't do it. So I decided quickly I have to play the game in a different way. And like one of the other guests said, this is not a winnable game. If you play the insurance model, you're going to lose because they have all the cards. And ultimately, they work against the doctor and the patient. And I think a lot of my colleagues have run away from the challenge because it's scary, it's easier, but it's not better. And they're figuring it out. And if you take your power back, and that's what you all provide for us, power to the patient, power to the physician, and it's a growing market. I think the patients are now, the pendulum has swung so far that they're looking for answers, and everyone here is providing it. And I just want to thank you because as a physician, it's lovely to see a patient who's coming into my office, who's a partner in care, who asks me, well, I tell them anyway, because I'm price transparent, how much it's going to be. What can they expect? That's a doctor-patient relationship. That's what it's built on, communication. And Sedera, to me, is the future. I mean, you guys are powerful and you're willing to take chances, but honestly, I think it's going to get easier as this goes on.
Well, thank you for that sort of message of appreciation, because it's true, you know, all of us involved in this sort of free market movement, any step that we take helps everybody else who's involved in this movement, which I think makes it all the more important that we find ways to work together.
No question.
So how did you, as you moved out into an independent type of stance as a ear, nose, and throat surgeon, how did you survive? What did the insurance companies do about you? How did you find a way to make it work?
Well, I looked at my bottom line. You know, I was like every physician, you sign every single contract because you're told if you don't sign them, you won't stay open. And I started to look at my payers and exactly what they were inhibiting me from doing. And unfortunately, I gave up a lot. I trained in New York, I trained at Mount Sinai and Sloan Kettering. I did cancer surgery, ear surgery, I did everything, peds. And I gave up a lot of my practice in order to stay open. So I don't do head and neck surgery, I don't see children. I stopped seeing Medicaid and Medicare because it was not conducive to staying open, but more importantly, it was working against my patient. The patient and I should decide what constitutes care, not an insurance company. And it was becoming so onerous that the joy was being taken out of practicing medicine. And so I got rid of everything and every player that was keeping me from being the best doctor that I could be. It was an easy call for Medicaid and Medicare. I mean, for Medicare, if you underbill somebody, that means you don't charge them what you're allowed to. That's a crime, that's fraud. So you have to look over your shoulder 24/7, and you never know when you're going against the grain, so that was easy. Medicaid, you know, unfortunately they don't allow you to take care of patients and provide them the services that you should because they don't cover it. So those are the first to go, and then insurance companies that don't pay for services. And then I started to look outside the box. I'm an integrative type of doc, so I wanted to start treating patients and treat them so we can prevent disease, not just take everybody to surgery. So my practice is a little bit different, and fortunately I'm a big thinker, so I love to do surgery in the office. And that was the first thing that I found. If you can keep it in the office, you don't engage deductibles, a lot of things are co-pays, and you make it affordable for the patient. So 90% of my practice is now office-based surgery, office-based care, integrative, preventative, and so it's a little bit different, and it works really well for me.
Now, you made a comment which I found particularly interesting as a fellow physician, and that is, you said that the insurance companies, I can't remember exactly how you phrased it, but were effectively harming your relationship. Amplify on that.
It got to such a point that they were telling patients the exact opposite, anything to put the patient at odds with the physician. But we got smart and we started doing three-way calls so that the patient could hear what the insurance company was telling us, and then the story magically changed. Their job is to make us the enemy. That's what media has done. That's what the status quo has done. We're the face of healthcare, so it's our fault. And that slide about 20% of costs being physicians, I would venture to say it's physicians who are employed by hospitals where that cost is high, not independent doctors. I haven't raised my price in about 15 years. I still charge the same amount. I don't get it, but I still charge the same amount. And it's not us. We're actually the drivers of the efficiency of healthcare. I know my patients. I take my calls free. I don't have all these middlemen between me. I don't use, physician assistants, medical assistants. I take care of my patients. They don't call for prescriptions. They come and see me if they need me. We do virtual telemedicine. We do a lot of things to make it patient-centered and cost-effective, and they don't get admitted to the hospital. So my office is not one of the players that is just jacking the price up and writing prescriptions, and unfortunately in some cases we've seen do unnecessary procedures. So when the patients know what the cost is, and I should say too, if I walk into my office and have to do a telescopic exam, I tell the patient before I do it how much it's going to be. There are no surprises in my office. Before I touch them, they know exactly what the allowed amount is and what the cost is. And everybody is so grateful. I don't think anybody tells them this, but it gives them the standard that they should now think of themselves as consumers and stop taking what they're given. That's another thing we've been told, that having health insurance equals access to quality health care. It doesn't. It just gives you a card, and most of the time you can't afford to use it. And that's where Sedera and medical cost sharing comes in. It's a two-tier system. If you're accessing it with your cash, you're paying a heck of a lot less, you're getting better care, you're getting faster, efficient treatment than you are if you use your health insurance card. And I've been preaching that. I've been on radio shows, I've done media nationwide, and people are gasped when you tell them it's cheaper to access healthcare if they just pay for it, but it's true.
Now, Elaina, that's a natural segue to the fact that you do more than you do radio shows. You're really a radio personality. Tell us a bit more about the sort of public face and message that you're bringing.
Well, I decided that instead of complaining, I would actually do my therapy on radio. So I started my podcast, and every Wednesday I'm able to just put it out there. And I have low blood pressure, low cholesterol. It's a great hour. But it's about exposing the inside of healthcare. Nobody really understands how it works. They didn't understand that doctors get paid a fraction of what you see on those hospital charges. They don't know about facility fees. They don't know about how hospitals really work, and how if you're a primary care doctor, you admit a patient, you lose control of your patient. The hospitalist takes over. The hospital takes over. This is a whole system built on the backs of doctors and patients, and we've allowed it, and we have to take our power back. That's the key. You guys are the first line of defense for us, because if we can be paid for what we do in a fair way, and the patient can afford it, then we've actually are the beginnings of breaking this system. I don't believe it's the government that's going to do it. I believe it's us.
Well, I would definitely go along with that. I don't want to steal any of your time, but just very briefly, I lived and worked in a very poor part of London for many years, and I guess living there in what most people would have called the sort of trash can, the dustbin of England, the lowest of the low, I became very convinced that virtually all of the government attempts to help the poor were actually trapping them in their poverty. They were just becoming so used to the handout that it was almost impossible for them to break out of it, even for those who had the initiative to do so. Now, you've created a very substantial platform. I had the privilege of being interviewed by you a while ago on that platform. But that platform has opened the door to even larger platforms for you. Some of us noticed that you were at the White House recently. Maybe you could tell us about that.
You know, it was a surprise to me. One of my colleagues who does a lot of healthcare policy put my name out as somebody who might want to speak about healthcare price transparency, since I've been talking about it for years. And the next thing I knew, I got a call. They asked me what I would say to the president if I had a chance, and apparently it was pretty good. And I ended up, up there. And I expected to be in the audience, coming up to a mic. I had no idea that was going to happen. So it's a good thing I didn't. It just kind of happened out of nowhere. But I hope I spoke for doctors and patients, because that was my goal, is to be the unspoken voice for what it's really like on the front line, and how hard, and how much we care about what we do, and how we're being thwarted by a system that's designed to make as much money on our backs as possible and put us out there as the boogeymen. I'm done with it. And so what we're doing now is not playing the game. It's creating a different pathway, finding like-minded people. And I'm telling you, the patients, if once you build it, and you are, they will come. I see it every day. And once we get that pathway set where it's an option, it's all about choice. Nothing works for everybody. That's why I'm not a big fan of the Affordable Care Act or single payer, because it can't work. And all it does is empower the same people, the same entities that are driving the costs and making healthcare terrible. Giving them, doing the same thing, expecting a different result, giving them more power, keeping the pocketbook with them is not healthcare. We have the power to take it back. And I think we're the, best kept secret at this point, but not for much longer.
Well, I can see that there's a lot of agreement in this room that we're not going to be the best kept secret for much longer. So I have one little question, easy to answer, and then a final question that I'd love to hear your thoughts on. When you take a step like this, what do your professional colleagues think about it?
I think I'm a little bit spoiled, because in Atlanta we have a consortium of doctors. We have direct primary care doctors. We have specialists who work with the DPCs. We have price transparency throughout the system. So I can call up my colleague and say, hey, an endocrinologist, a psychiatrist, a GYN, ortho doc, and they're all transparent. So I actually don't have any drama whatsoever.
Even from the other ENT surgeons?
I just do me, right? There's enough for everybody. I have my own lane. I just follow my path as God gave me, and thank God I'm able to do it. So no, I don't really think about that. But I can tell you this, I'm getting a lot more patients who are asking for second opinions, who want my time. I spend 45 minutes with a new patient, 25 with an established, so I'm not one of those get them in, get them out doctors. I don't call in prescriptions. They have to come in, unless it's telemedicine and I've seen them. So this is old-fashioned medicine, and you can make a living if you do it the right way. There's no shortcut.
That's so true. Coming from a family of physicians myself, I really appreciate actually the emphasis on the old-fashioned physician.
Definitely.
Well, as a final question, you very graciously agreed to come down and share with our conference today. I know you've also helped with some of the other healthcare sharing ministries that have helped pioneer this type of approach. What do you think is the future for what we're trying to promote in terms of medical cost sharing?
The future is disruption of the system. It's creating recreating medicine the way it's designed. Doctor-patient relationship, where the fiduciary responsibility is to the patient, not to the hospital, not to the insurance company. Disempowering the people who have jumped into the middle costs both us, the doctor and the patient, money, treasure, health. We need to take our power back. We are the best doctors and patients, the best arbiters of care. Nobody else should have that right. And in health insurance companies are practicing medicine without a license. That's what it's come to. When they're telling you it's medically necessary, and my ENT, board of ENT board especially tells me what constitutes reasons to do a procedure, and they're telling me no, it's not. That's not appropriate. But they have the power, and they're doing it, and it's fraud. Honestly, if you really want to think about it, people are paying a premium for coverage, and you have an insurance company with a peculiar incentive to say no, and they get to run the ship. And me as a physician, we don't have any power. And then we're the ones held out there as the reason health insurance is broken. It's wrong. And I think at least we're now moving back towards the middle. The government has become a little bit more user-friendly. For example, I don't know if people know this, but if you see a physician in a private setting versus a hospital setting, the hospital setting got paid about 6 times more for the doctor visit than the independent doctor. And now the CMS, Seema Verma, those guys have actually made it parity now. That's the pendulum is swinging back. It didn't just happen that we were 60% of doctors practicing, independent docs, going down to 30%. That was by design, and I think it was all about control. But it's not going to work, and as long as you guys are out there doing what you do, it can't work. Thank you.
Well, Dr. George, you're clearly taking back control. We say thank you for coming and sharing that with us.